Movie star. So I don't think Melissa has any major issues like Shannon did. And I would have done this on Shannon, as I said, except my concern was fatiguing her muscles before we equilibrate her, which I didn't really want to do. So Melissa, I don't think has any real muscle problems, so she shouldn't really easily fatigue, and that shouldn't be an issue. So what we're going to do is just demo a whole bunch of different things that we do with the functional. No photos today. If we start doing photos, we're going to be here all day.
I didn't know if you were going to mark her.
Well, we can, but I thought we'd look at cases at Rattlesnake later. Because, yeah, if we start doing photos, I was going to do something else, a different workshop for photography, because photography, to do really good photography, takes a little bit of work, a little bit of practice. It's totally something you can learn, though, totally. And, you know, the photography that we've been getting is pretty good. You just maybe need, like, some editing, too. Editing skills are critical with photography. So basically what we do is we have the patient fill out the TMJ questionnaire if they have muscle pain. Not everybody has any muscle issues. The routine that I do in my practice is if somebody comes in and they want some kind of complex dentistry. So somebody will call our office, they'll say they want to come in for a consultation for veneers, or, you know, some people know that they need a whole bunch of dental work. So we'll bring them in for a short consult. Typically 20 minutes is all I'll book, because you don't know what these patients are going to be like, so I don't want to book a lot of time with somebody that I've never met. So they come in for 20 minutes, half of that's usually spent with Amanda, and then I'll come in and talk to them for probably 10 minutes. And if it looks like I can help them, and if they seem like they're reasonable people and not a little crazy,
Which is usually forewarned.
yeah, Amanda can usually tell. So for the most part, the reasonable people, I will tell them, for us to treat you, we would bring you back for records. We do all our records, and we basically do what we call the functional analysis, and the models, the photos, the records, the x-rays. We'll bring you back for an appointment for all of that, and then we have a treatment planning consultation, an actual treatment planning consultation. And you can bring your spouse with you to that, and that's when we'll figure out your plan, and I'll give you some estimates. I don't give them an estimate in their 10 or 20 minute consult. I occasionally will give them a range, just so that we don't waste everybody's time. But you can't really give them an estimate till you've done the workup. So we tell them the workup's typically $500 roughly, depending on the x-rays, which isn't a huge amount of money. It's really not that big a deal. It shouldn't be a limiting factor for most patients if they're serious. If the patient's just kind of, you know, a little flaky and is not really serious about getting treatment, the $500 is enough to deter them that you'll never see them again. So it's good, because you don't want to spend all the time doing all this records, mounting, looking at the case, looking at the digital photos, putting it all into a Keynote, because I put it all into a Keynote and show it to them. You don't want to spend all that time, and they can't even afford, you know, 2 veneers. So I want to at least have some small fee, which is $500 roughly, that will deter the people that are going to be a little crazy. Not even crazy, just like completely cheap, even, you know? Like, they have to understand that there's some investment involved in working up the case. And then, so that's basically what we do. We have a free consultation that's about 10, 15, 20 minutes. At that point, I tell them, you know, really to go forward with helping you. I think we can help you, but to go forward, we have to do we need to do a detailed workup and then another consultation. And this is gonna be $500, $600, something in that range. And if they don't, the ones that are, the people that have come in and have been referred and are serious, that's fine. They go ahead and do that. And the people that are just not so serious, just kind of wanting to see what's out there, you don't see them again. So that's not a bad thing.
There's people who just don't have any concept of the concept.
Yeah, they have no concept. They have no concept. Yeah, so I'll ballpark it to them. I'll say, you know, I do cases from, you know, $8,000 to $70,000. You might be in the lower half of that. You might be in the higher half of that.
You don't even sit them on the chair and have a look in their mouth.
I do a quick look. I think I've done them both ways. I've done them in the operatory with a quick look, and I've done them in the consult room, not even looking at them, just talking to them. And I've lately been doing it more in the operatory with a quick look, and I'm not sure which way is more effective.
So do you tell them at that short appointment how much their consultation fee?
Yes, I tell them the records fees typically around $500, and that includes your next 2 appointments. And that's what you need to pay to get a treatment plan, basically. And that's just the way it is. And most people, if they're serious about having treatment, they don't have a problem with that. And if they're not serious about having treatment, what it is it's a good weeding out of all these consults that you get. And I'm actually thinking I should almost weed them out even more than that and send them a letter when they book a consult saying your next appointment after this is $500 just to get records, or something nicely worded, but just so that they don't even come for the consult if they're that. Do you know what I mean? Because some people, they just don't know. They think that they'll come in and you can redo their mouth for nothing almost, right? Or for their insurance.
Yeah, for their insurance.
So it's good to get some reasonable expectations, because you could waste a lot of time with people working up their cases and thinking about their cases and not doing their cases. So I'd rather spend more time on the less people, essentially. And another tip is never do the diagnostic wax up before you've had the final consultation and they've paid. Or at least paid a deposit that more than covers the wax up. Because you don't want to get stuck with a $1,000 wax up. So I've learned that the hard way. Once. You do it once. That was about 13 years ago. So basically, that's what we do. And so this would be that second appointment. This will be what we would do at that second appointment, essentially. The only other thing we might do is the perio exam with my hygienist. So usually that would be coordinated with this, unless I decide I'm going to do the perio probing, which I occasionally do. So basically, I'll walk you through. It's going to go in the order of the functional analysis sheet that you guys have. And we don't have to do the perio and the aesthetic part of that. That's stuff that you guys can figure out very easily, so we won't worry about that too much. You can look at the setup that we have for this if you want. I've always thought I should photograph that. Maybe I will right now. You're working, you never get around to photographing some things. So I'm going to photograph this. I'm just going to use this camera because it's easier as opposed to using my D. Oh, which one's this? Where's Melissa's camera? These are all set up for macro. Yeah. I don't want to use one of the macro cameras right now.
There's one here that nobody else can use.
Yeah, I know. That's my D2X.
I'll grab it on my way out.
I have a patient who wants to buy my extra cameras, but I've never really wanted to sell them.
I'm not looking to buy it.
Yeah. Well, at least you're honest. Can I photograph this?
GPS chip inside.
I like your honesty.
A couple of people can see it.
What? Do you want that off up there?
No, it's fine.
We're going to take pictures throughout the weekend for my Facebook page and maybe my blog, just so you guys know. Has anybody seen my blog? Yeah, do you like it? Yeah, it's got lots of, I'm trying to put lots of...
Short and sweet.
Short and sweet, yes. I've tried to max the articles to 300 words.
It's nice that
And then pictures.
pages and pages.
Yeah. It's a new thing I'm doing. I think it's fun. It's just every week I have to think of something to put in, right? Yeah, you have to be thinking, okay, what's this week? And I usually do it Tuesday night or Wednesday night. And then Jennifer sends it out. Okay, mask. So, Melissa, you don't have any muscle issues, do you?
Not
Do you ever get headaches or tension or wake up with tense muscles?
the odd time if I'm super stressed out. or
Super
whatever.
stressed out? Okay.
Yeah.
It's that associate. No, you didn't have to work with the other one. But she was nice. She just was inexperienced. So, okay, so no real muscle issues, no problems. Okay, so for muscle palpation, I would usually palpate the temporalis. It's pretty rare to have somebody with temporalis pain. I'd usually be up around here and back through here. The odd person has temporalis pain, but it's not that common, as I said. The masseter is the more common one for people to have tension or pain in the masseter, and we just usually palpate along here. And I'll ask them to just close your teeth together lightly, and then clench. And then you could really feel the masseter muscle size. And she actually has pretty developed masseter size, so that's good. So you might clench a little bit at night. And then the digastrix down under here. You could try and go in the mouth and turn and try and get the lateral pterygoid, but I don't think that's practical. I generally never try to do that anymore. I used to after taking some of those courses. But so muscle palpation is 0. So I would just on the, negative. Perfect. So that's that. Next is range of motion, and this is the TMJ tri measure. If you look at it closely, you'll see it in your rooms. It has an area that goes 1, 2, 3, 4, 5, 6. This is the side that I measure the range of motion opening because they're parallel. So you can go 4 and 5 are the same, so that's 40, 45, 50. If you turn it the other ways, it doesn't work because this is the 0 to 10 scale for lateral movement. This is the scale here for opening. So just make sure you have it on the right way, and you'll be able to easily see the opening measurement. So if anybody has any questions when they're doing it, just ask me. So just open. So see, now I put it in and we can line up. So we have 40, 46 basically. You can see 46 there and there. That's the way that lines up. And she opens, that's the normal amount. I usually see somewhere between 40 and 50 for most patients. If somebody, as I said, is under 20, then they have some serious muscle issues that you need to work through first before you do any treatment for those people. Open. And usually I try and go somewhat behind them and see if they're opening straight up and down or if there's deviations. Just close, open. And she deviates at the end. So she opens and then right at the end she's deviating to the left. You didn't know that, huh? Close, open, close. She's deviating. Now this is obviously just an estimate because I'm looking at where she is. If she went straight, she's probably going 3 millimeters, 4 millimeters. Open, close. Anybody want to see? You can come over here if you want to see, if anybody wants to see. Open. See how she's right near the end? She turns that way. So she's deviating a little bit. Maybe. I haven't checked that yet. So, uh-oh. And then, uh-oh, we're going to have to break out the equipment, guys. And then I line this one that has the 0 to 20 on each side up in the center and have her close almost all the way. Just open about just a quarter, a tiny bit. Yep, and now move to the left. That's good, and back to center, and move to the left. It's okay, and back to center, move to the right. And so you're getting a feel for how far she can move right and left, and she was going about 10. So that's a good range of motion. And she was going the same on both sides. Some people will go less on one side than the other. So look for that. That could be something blocking them in their joint. And then protrusive, we just bite down. We basically measure the amount of overjet first, and she is, yeah, it might be easier, you're right. She's about 3, and then go forward protrusively as far as you'll go. Yeah, it might be easier with a perio probe. So she's going protrusively a total of about 8 millimeters. So this might not be the best for protrusive, but whatever. And next we'll Doppler. So you need this little gel to transmit the Doppler easier. So I just put it on the area. Usually it's right in front of the ear, right here, somewhere around here. We're just estimating. It's only an issue with guys with big beards. And then you can hear it. So you can hear the blood flow. Then I turn it in and open, close, open, close. So that's a moderate amount of crepitus, and that's probably what you'll find on almost everyone. You'll all have that amount of crepitus, I would guess, or more. And that's pretty normal. Now open about halfway, close, open, close, open, open the rest of the way, close, open, close, open, close, open about a halfway. So I didn't hear a tremendous bad amount of crepitus when she opened halfway. That's the concerned area, is the first part of opening, because that's the initial rotation on the medial pole. If you hear a lot of problems there and an immediate click, that's often an issue. I didn't hear any clicking with this side either for her. So we would rate that as medium crepitus. And I thought it was mostly lateral pole. But the crepitus shows us that the patient has some breakdown in their joint. You know, there's some wear and tear in there. And I always tell them that. And open. Oh, close. Open. Close. Open. Close. Open. Close. I heard a click there.
Yeah, I heard one.
Open. Close. Open. Open and more. Yeah, didn't hear it again. And open about halfway. Close. Open about halfway. Open all the way. Close. So we did hear one click. You can write down that we heard an occasional click.
You almost see it going over his head.
You can see it.
You can see it.
You
You
can
can see it.
almost like she's already
Click, yeah, near the...
like, but she almost like when she opens it there, she's almost looking like.
Okay, when she shifts, she clicks, huh?
This one you can
Yeah.
you see it kind of flick
Really?
something or pick out something.
So yeah, so that's a good way to tell the patient that they have some breakdown and wear and tear in their joint. And it's good to tell them that before you do a whole bunch of work on them. Because this may never be symptomatic for them. But just once you start working on these people, they start getting more awareness of things going on in their mouth. And if they don't know ahead of time that they had these things, they'll blame it on you. And you don't have it documented, so it's an issue, potentially. Even though it's not a issue for her, even having that. But you maybe didn't even know you were clicking ever. So now you're unfortunately aware of it.
That's just every day.
It's like, what am I doing? I can click if I eat licorice and chew laterally on licorice. I can make my joint click. Yeah, Will Doppler Shannon, she has a lot of clicking.
You can do me also. I've got
Click, good click.
a lot of noise.
A lot of noise? Awesome. Noise is good. Okay, so flip the page.
I distinguish click from pop.
Click and pop is the same thing, really.
But I call click the more.
Oh,
Pop,
okay.
Pop is a soft click.
Yeah. Yeah, I don't get into the differentiation. Okay, so what's next? Palpation. Do you have any pain in the joint when we... So some people do end up having pain in the joint area. So you don't have any of that. And open, close, open, close, open, close. I don't feel any clicking. No. I can feel a little movement, but no clicking. And I don't feel any crepitus. Sometimes you can actually feel kind of the grunchy movement of the joint. Those are pretty bad joints. And you have no pain with movement in any direction. And just out of curiosity, we'll see how she manipulates. Just open, close, open, close, and just let your jaw go. Yeah, maybe after deprogramming she could be manipulated, but I typically don't manipulate. So she's easier than some people. Some people you'll do that on and you can't move them. So she's probably moderate. Like some people, they're just completely loose and you could manipulate them easily, and she wasn't bad. So next we'll do the leaf gauge, and with the leaf gauge we'll load test. So these are the leaf gauges from Great Lakes. And I'm just seeing them now. I actually they used to have some that were not very good. They stuck together too much and they didn't open easily. So yes, I hated those. Hated those, but these are nice.
You got numbers on them?
No, but you know what? The ones that I bought that had numbers on them, they keep coming off when we sterilize.
Yeah.
So, and these can be put in a Statum. Yeah, these are pretty good. I'm liking these, so that's good.
Oh, that's, yeah.
Because we've been
better.
cold soaking
Yeah,
ours.
The old ones are called
Plastic.
Yeah.
Oh,
Okay, so
Yeah,
just
you
bite
have
down.
to really clean them well.
There's that many things.
Yeah. So just bite down, go forward, go back, and go forward, back, squeeze. When you squeeze, are you feeling any pain or tension and tenderness? So you don't feel anything. Okay, that's good. That's what we want, basically. If everybody was like that, life would be fairly easy. Then you wouldn't need any courses, though.
And that would be easy too.
Yes. And I'm estimating we have her at the thinnest point, at least 2 millimeters. Close, squeeze down. I'm just trying to get a gauge on how thick the bite record will be. And I think we have plenty of thickness here. Open, bite down, go forward, back, squeeze. I don't think I'll make it a lot thinner though. As I said, I'd rather it be a little thick than too thin. Too thin is very hard when you're working on it. So we're gonna do this. Do you have the bite record? And what I'd recommend is maybe just have your assistant dry the upper teeth off a little bit so it sticks a little bit. And I'm gonna demo wax too, just for the people who really still like wax. Because wax does have some advantages. Although I'm typically using this more now. So just a lot, all the way up to the cuspid. You want the cuspids in this. And then we put this in. Okay, bite down, go forward, back, all the way, squeeze.
Can you just pass me the tips there? Or cup with the tips then? Yeah.
I don't know, Melissa times it and tells me.
40 seconds.
Or Amanda times it and tells me. One of them does. And I'll sometimes keep them held seated. Some people will open a little bit on you, so you want to keep them seated if you're in doubt.
Does it make a difference that lying down or sitting up while doing this?
I'd prefer them lying down. I think it's easier to get them seated. I think it's easier for you to do it too. I'd rather do all these kind of things lying down. The face bow I do standing.
That's it.
That's it. Open. Yeah, so this looks just like futar. And yes, you can trim this with a burr. I use a scalpel. But that's just my being used to preference. So it's good thickness everywhere. It's not perforated anywhere. Could even make it thinner if we wanted to, but I'd, again, rather it be a little thicker than a little thinner. Let's have fun. We'll do one with wax.
So you hold on that just to keep it in place, or just to help?
The guy, just so it's not, yeah, you know how you shake? when
So
you-
here's a water bath. Yeah, she helps me so I don't look like dyslexic. It's good in videos. So this is Delar wax, and it's a water bath. I like these singles. It has this little little foil to hold it. We stick it in here till the corners kind of get rounded. When the corners are rounded, it's generally good to go. I want the teeth wet with this. If they're not wet, it sticks to the teeth too much. And I actually wet my gloves so that I can touch it without it pulling off.
Do you fit a phone now or no?
No, but I like, you know what? It's easier to trim than polyvinyl. So the bites are typically a little easier to put together. The difficulty is it's easier to trim, but it's easier to break. So there's good and bad, you know? Actually, leave that in so we keep her deprogrammed.
That sounds like Blue Moose.
Blue Moose is good. All the bite record materials are good. This one I've just used a lot for years. It seems to be easy to trim. It's the same as, it's similar to Futar. You guys used to sell Futar and now you...
Still do.
Oh, you do? Okay.
Yeah.
I thought you'd
More
replaced
than
it.
anything else.
And is that your own thing?
No.
Where do you get the AccuFlow? Is it out of Europe?
We don't
Yes.
use that. We're on Sydney.
Yeah, we used to use food chair from Kettenbach.
Yes. So you want the wax quite soft.
Yeah, it's awkward, isn't it?
You look it up and I go like, oops.
Oops, that's me. Let's give it a second more. This way I could show you trimming the wax tomorrow too. That's why I'm going to do it. I don't mind the wax. My water bath broke and I stopped using it. If you want the honest answer. I tried to get it fixed. They sent me another one that was crap. Not you guys, Shine.
Crap.
It was crap, and I decided, screw it. I'm tired of dealing with this. Open. So I put it on. My gloves are wet. This is still not hot, soft enough. I got a feel for it there. You don't want resistance. That's the only issue with it, is if it's not soft enough, the patient might deflect when they bite into it. With the bite record material, there's no real resistance, so they don't deflect. Did this just turn on? Is that? No, it's not.
For like 2 hours.
Wow.
And now I'm high.
Yeah. It's not that
It's
hot.
not very hot. Do you want to go to the kettle?
Slide forward, slide back.
She knows the drill.
Okay. While that's heating some more, I'll do one more of these so I can check the two of them, since that's being less than cooperative. The nice thing about this is you inject it and it's instantly ready to go.
Yeah, it's
So-
like Blue Moose.
Yeah. Bite down, go forward a little, back, all the way, squeeze. That's good. And we'll make the Lucia jig next. So I'm going to demo making a couple of, or a Lucia jig, and then we'll use this after. So this is the kit. Melissa's put some adhesive on it. That's the little jig. These are the class 2 jigs. I don't think she needs a class 2. These are the little kits. It's like about $100, pre-made jigs. Pretty cheap if you consider each one. The only thing I want to know is why don't they put perforations on the inside of this so it stays better?
Don't know. Good idea though.
You know what I mean though, right?
It's retention.
So they actually goes right through.
Yeah.
Yeah.
He's a quarter round. And
Yes, that's what I should do. Okay, you could take that out. So whale tail. Where's the whale tail?
Yeah, it's on those Ziploc bags. Is the whale tail on the... Oh, it's right here.
Okay. So this is that whale tail thing. I'll demo this before I put in the bite record material. This is a really easy system. So you put this in with the bite record, you put this in, and they bite down. And this kind of tripods the Lucia jig so it's in the right occlusal plane orientation, and it's seated. So open. It's quite nice. If you do it without the whale tail, you're kind of guessing how to orient it, and it's a challenge. You could use this maybe with even an NTI if they have a flat if you have a flat, plain NTI type of thing. Okay, so I load it pretty substantially, so I find it's more retentive. Put this in and bite down.
You can buy them separately. Some use them, some don't.
That looks good.
So that's just your bite impression material.
Yes.
So the blue moose
Multi-use. I don't know. I would think so.
Pretty sturdy too. Yeah.
I don't know how sturdy that is.
And see, I've made this a little bigger. So that's because it's more retentive that way. And you know, maybe if I wasn't paranoid, I'd let them sleep with it, but I don't want them to.
No, I wouldn't either.
Yeah, it's kind of small. Pardon?
Put a floss through it.
Yeah. They can pull it down to their throat.
Use the floss to tie it to the tooth.
Okay.
Open. So now we've got our jig. And basically bite down. So we can get them to go forward, back, forward, back, squeeze. And they're more open with this.
Not touching.
More open.
Use that to take your bite.
Well, you can. This is now another.
Position it anterior, posterior, the
How?
back.
I just stick it in and
That's
have them
right.
bite. Yeah, you know, because.
More forward because it's biting pretty much on the back, so it will be more. Like before
Open.
you take, before you put it in,
Yes.
before you put the impression. material.
Yep.
So it's the bite basically that centers it in both ways. Right?
Yes. Yes. So then we'll mark it. Actually, get you to do this one first. Open. Go forward and back on this. Open. And bite down on this in the back position. Tap, tap. It's moving a little. So you go back far. Open. And if you look, this is what we see sometimes. She's hitting more on the side, so I'm going to trim this. If it was just in the center, she's sitting on both sides, so it needs a little trimming. So if you want to trim yours, you can come and grab one of these, or you can use a high speed with, like I could use a high speed with this big KS burr and just trim it like this. So you could do that, or you could try it with one of these. With a lab handpiece, and like this. And all I would do is just trim it like. I've videotaped this before, close up, but I just trim the sides down a little bit. She's hitting here quite a bit.
Take the bite material right out of it.
Yep, take some of the bite material out of the bite. I typically trim the corners. Nine times out of 10, all I do is the leaf gauge. But this is good if you want to give somebody something if they're having a lot of muscle tension.
What's the longest you let somebody wear that for?
Well, they could wear it for a few hours. Shannon had hers for weeks before we made the Koi's deprogrammer. But she'd wear it a few hours a day for a few weeks. She said she felt so much better. She actually got stressed if she was losing it. She lost it.
Just a couple hours a day for.
Yeah, I don't know. You could have. Shannon, how long did you wear that thing?
2 hours usually, sometimes an hour, but sometimes a little bit more, just depending on the day. But after 2 hours of wearing it the first day, I could already open.
Bite
Yeah,
down.
that's what Nick said too.
Yeah, we made one for Amanda's fiance was having some muscle tension, and we made one for him just when he came in. He said he felt better pretty quick, huh?
Yeah,
Open, bite down.
He said he didn't notice it anywhere.
Open. Didn't notice it. Bite down. Go back, forward. Yep. Okay. Bite down, forward, back, open. Bite down. So we're more centered now. It's not quite on the edge. I think it's pretty good. Open, bite down, open. And what I'm doing is marking the spot bite down. And when I do her bite, I want to visually look in that she's on that black spot, not the red streak. Because if she's on the red streak, the bite's definitely not going to be right. She's still pretty open. That's the only drawback of this. It's more, I use it more frequently as a deprogrammer than as a bite record appliance. But it can be, as I said, done as a bite record appliance. So let's do a moose with this. Yep. Now open, bite down, bite on that spot and squeeze. Do you feel any pain? Any tension? You feel good? Open. You just don't want to touch the bite record material that's already in the Lucia jig, or the whole thing's going to be connected. Bite down, go forward a little bit, and go back now all the way. And squeeze. You're back all the way? Okay. It's the lukewarm water bath.
It's not high.
Throw that one too.
It's not a hot tub.
It's not a hot tub. My hot tub's empty. There's no water in my hot tub. No. We never used it anymore since we had kids. Open, bite down.
Yeah, mine's full of water and I haven't been in it
Open.
once.
I used it a lot more when I was single.
Entertainment purposes.
Yeah, by myself. Bite down.
Or newlyweds use them more.
Yeah, newlywed.
Newlywed,
And
yeah.
before kids.
Yeah.
Before kids.
After
Yeah.
kids, never got
Open, bite down. It got used like maybe once a year after kids. We'll do one more. So what we're gonna do is 2 each. Two with the, it'll be enough.
Okay, you use it
Open.
a lot in about 10 or 12 years when the kids bring their friends.
Yeah.
Yeah, the friends.
Well, I'll use it.
Like these kids were using it so much, splashing it everywhere, like it was half of it was empty, so we ended up, I turned it back, you know, I got them.
Bite down. Go forward a little. Back all the way.
Way, yeah.
Squeeze.
I got a 16-year-old son who'd bring a couple of friends, he'd sit in and then get the water all out of it.
Can you just pass me the marker from the top drawer there? If you could just get me the Sharpie out of there.
And so we're gonna put your bite records in. We'll put your bite records in these, and just mark down your name so you don't mix them up, and which one it is. Like leaf gauge 1, leaf gauge 2, Lucia jig 1, Lucia jig 2. Okay, just so you can keep track of that. Whoops. And if anybody's having muscle tension, just take your leaf gauge and leave it in for a while. Open. Or Lucia jig. I keep calling them the wrong thing. You can put this in with it too. Yeah, she knows what I mean. I'm dyslexic. I can't even tell my left from right. I think it's because I'm left-handed. Let's try one of these. It's not the hottest, so if you don't want to use these, that's fine. We'll use the leaf gauge, Amanda, if you can grab it. Oh, this isn't going to work. Yeah, this particular hot water bath is not warm enough for this. So I would put them in like this with wet hands, and then she would bite down on the leaf gauge, but she'll deflect because it's too hard. We'll check the other hot water baths, but we'll use this for the, it should be soft enough for doing the, what do you call it? The face bows. Okay, so let's do the rest of this, then we'll do the face bow demo. So the only other things that we'll look at here is the point of initial contact. So I use the leaf gauge to find that. So now I've got all these leaves. I'm going to take out at least half to get an idea. And most of the time they're not feeling it at half. Occasionally I get surprised. Bite down and go forward a little, back all the way, squeeze. Do you feel any contact anywhere? Maybe one place? Okay. So that's fairly open to feel contact. Open. I know Shannon feels it with quite a few leaves still in. Bite down. Open. Bite down. Open. Bite down. Oh, bicuspid. Open.
Where's the piece?
Right there. Let me see another one. So I could have marked the whole mouth, and I would have seen marks everywhere, I bet. So I always use the shim stock to find this. Otherwise, I don't know where it is. So it seems like it's the bicuspid. Now, sometimes you'll mark the bicuspid in the mouth, but when we go to the mounting, it's actually further back. Further back is okay, as long as it's not anterior to your marking. When you go to the mounting, open, bite down, yeah, open, bite down, all the way back, open, bite down, all the way back, open. Yeah, she's on the second bite. And sometimes you see them on the bites. Usually, though, it's the second molar. Bite down, all the way back. Open. Bite down. Open. Bite down, all the way back. Open. Bite down, all the way back. Open. Bite down, all the way back. Open. Bite down. Yeah, open. Let's just double check the molar. Bite down, all the way back. Where do you feel it? Right around the bias? Yeah. So that's it. Bite down, all the way back. Open. Although I am marking a molar, let's just make sure that that's not it. This one's kind of destroyed, I think. If you can give me another one, it was pulled.
How do you pick the exact
Open.
spot on the first try?
Pardon? I don't know. That was luck. I didn't think that was. I thought I'd be open still. Bite down all the way back.
One more in.
Ah, the molar. It is the molar. Open. It just wasn't catching before. Bite down. I get suspicious if it's a bicuspid. It's usually a molar. Open. Okay. I'm finding it on the. Let me see another piece here. I just got to make sure.
That there's like one of the premolars that's loose.
Bite down.
That's probably for prematurity sometimes.
It could be. That's when it's often the premolar. Bite down.
That's mostly on people who lost their
Open.
molars.
Yes.
Or who lost at least one. You
Bite
know,
down
you know,
all the
the
way.
children is kind of,
Open. Bite down. Okay. Yep. So I am finding it. Beauty. Open. Yeah, I have two distinct contacts. One is on the. I don't know if you guys can see these. I'll photograph them. One is on 1/6, right on this distal buccal cusp, the incline right there. I could use the scope to show you this. And one is right here on the mesial marginal ridge, basically. Do you want to
Both
turn,
two?
is the scope
It is
on?
Mhm.
Let's just, can somebody give me my controller?
Yeah, it's that big weird thing right there.
And I'll just switch the TVs to the microscope and I'll show you the contact. I just need the chair lower when I'm using the scope. Oh. What's going on? That's...
Yeah, there you go.
Okay, so... Open... You can see the two contacts right there.
1/7 using.
Yeah. And 1/6. So usually what I'll do is I'll photograph that as a record as well in the chart. And I'll go around and photograph all the points of initial contact you guys mark so that we can look at them tomorrow when we do the mountings. It'll be fun. So, just have a couple more things to do.
Like
Yours
Two
zooms in.
contacts on this one.
What? Yeah, it's got an automatic zoom.
Mine I have 6.
Yes, most of them are steps. Is yours Zeiss?
No, I have global.
Global, yeah, those are good scopes. This one though is like totally, it's really cool.
I would just like autofocus.
Autofocus is awesome,
I
yeah.
thought it was a foot pedal.
I don't have to move them around.
But you have to put your hand up there, which means I still can't use it.
I find it's good. Let me see another mirror.
They have a foot piece there.
I probably could get a foot piece, but I'm sick of foot pedals. I've got too many.
You have
Between,
both hands in there and you're working. And you
yes,
could just hit the button to go auto zoom. That's the only button I want. I don't really care about it.
auto zoom. Yeah, that would be good.
Or I mean autofocus.
Yeah,
Because the camera is always in focus, but
yeah, I know what you mean.
the monitor is always in focus until you're like way out.
Yeah.
Yeah, she doesn't really have any mobility. Maybe M1/2 on the incisors. Upper incisors were about M1/2.
Just make some up. Make it simple.
Yeah. And maybe the lower incisors, but really not much. Okay, and then fracture. Didn't see any fractures. Do you have any sensitive teeth? No? And then the other side, just the perio, right? Anesthetics?
Yeah.
Okay, so that's basically what we're looking at. I'll do the face bow now, and then we're going to do the equilibration.